Everyone watching this has met or will meet a Christopher Doe in their lifetime. Christopher is a passionate baseball player, an excellent student, a loved son, an individual with goals and aspirations, like many people his age today. Baseball was his game, and when he was on the field, his presence dominated, as he was not only good at the game, but he was loved and supported by his friends, his family, his teammates. But the day did come when he was no longer able to enjoy the game, when the game became a mechanism of escape from the harsh reality that he was living in. Christopher sustained a back injury after a motor vehicle accident and was prescribed opioids to help ease his pain, which frankly is a very common occurrence. Anne-Marie, his mother, noticed a change in behavior after he finished the course of painkillers. She said that when she looked at her son, it was as if he was no longer there. Her son, who was once passionate about life, who was strong in the face of adversity, had weakened in many aspects of his life. The son who always left one hand open, like in baseball, so when life hit him with something, he would strike right back. That son was gone. He was gone when his life began to revolve around that bottle of pills. Now, instead of thinking about going home and grabbing that baseball mitten and heading to the park, his only thoughts became how he was going to head home, grab that pill bottle, take a pill, and relieve his pain. And that high he felt during the game was no longer enough to sustain the psychological effects that his body was facing. The adrenaline, sweat, intensity that gave him inner peace after a game of baseball were replaced with a pill bottle that provided him peace but ignited war. Now, one pill daily became 25 pills daily, and when his mother sent out for help, no treatment facility accepted him due to his aggressive behavior and demeanor, and at age 22, Christopher died from an opioid overdose. Why am I telling you this? Why is it important for you to know of Christopher? Christopher is one of the thousands of individuals who have died from an opioid overdose. Mark Bauer, 18, died from prescription drugs. Brenda, 25, prescribed opioids and has been in recovery ever since. Courtney, 16 years old, took an opioid prescription from her friend and is still currently in recovery. All these people were looking to find a solution to a problem they had, but instead were judged for how the opioids affected them, and instead of being welcomed into sobriety, they were turned away and left to deal with it alone. The opioid epidemic begins and ends with how we understand opioids. Opioids are a class of medication found in the opium poppy plant, and these medications create various effects in the brain, such as relieving severe pain. They're often prescribed by doctors as painkillers or sold as legal drugs in the street, such as heroin. So opioid drugs begin to bind to opioid receptors in the brain and spinal cord, and in doing so, it blocks pain signals between the brain and the body, and that in return creates the relieved feeling that the users get addicted to, the happy, relaxed, or high feeling. And the most commonly prescribed opioids are oxycodone, methadone, oxymorphone, and we have hydrocodone, codeine, and morphine. Now, according to the National Institute of Drug Abuse, there are 17,029 deaths from prescription opioids alone in 2017, from 70,237 overall opioid overdose deaths. From 1999 to 2017, more than 702,000 people died from an overdose of drugs. We can never truly understand the pain an individual is going to, because pain is subjective. Today, if you were to walk into an emergency room, what is the first question they'd ask you? The first question they would ask you is, what is your pain level on a scale from 1 to 10? Now, this is an important question. Why? Because questions like this are subjective. I could have a pain level of 1, but make it seem like I'm a 10. And a person with pain will get pain medication. And it doesn't have to be morphine, but it will be some sort of pain reliever that will give the drug seekers that quick fix when in reality they need long-term treatment. However, emergency rooms aren't made for long-term treatment. And this is why it is imperative that we increase the regulation on opioid prescriptions and for physicians to push for more alternative routes on pain relief, especially for chronic pain patients. According to the National Center of Complementary and Integrative Health, there are several alternative alternative health approaches for chronic pain patients that evidently suggest they are capable of aiding with conditions of pain. These approaches include acupuncture, meditation, spinal manipulation, and even yoga. According to the American Society of Anesthesiologists, acupuncture, surgery, nerve blockers, and physical therapy are safer alternatives to opioids. Opioids and pain medications should always be the final solution to any pain or chronic pain type conditions after a physician has tried alternative solutions. A combination of these methods, along with over-the-counter alternatives such as Tylenol and ibuprofen, are known to be safer and more effective. According to the National Safety Council, opioid painkillers are actually less effective in treating pain than ibuprofen and have far more dangerous consequences to their use. Opioid use can lead to more problems than they were meant to treat, which is why reducing their prescription and focus on using non-opioid alternatives for pain treatment would be greatly beneficial for patients and society. I want to emphasize something that I said in the beginning, and that in this lifetime we will meet, or maybe we have met, a Christopher Doe. And this person could be our family, our friends, our teachers, or even a person that sits next to you in class. And he should have never been left alone to fend for himself. And it wasn't just the healthcare system and the laws that failed him. It was the negative stigma that surrounds drug users. If you use drugs, your perception in the eyes of the world changes forever. How do we know this? Well, have you ever gone up to a cancer patient and told them, your life choices are the reason you have cancer? Or, oh, you have cancer? Wow, that's terrible, but didn't you smoke your entire life, leading to your lung cancer? No one ever says that, right? Or how about someone who's had a heart attack? Do you tell a person who's had a heart attack, you did this to yourself? You deserve it? No, you don't. So why is it when drug users die of an overdose from the effects of their addiction, the common reaction is, oh, you did that to yourself. You deserve it. You can link an individual's smoking habits to their lung cancer diagnosis, or a person's eating habits to their history of heart attacks. Despite the many flaws in our healthcare system, when these medical emergencies occur, there's a set treatment for them without having to face a systematic judgment. You won't be judged harshly for having cancer even though you smoked your entire life, ultimately causing that cancer. You won't be judged as harshly for having heart attacks even though you made the life choice to eat McDonald's every single day, ultimately contributing to your history of heart attacks. If you make these choices, you have medical programs and can seek endless help and support from your family, friends, and neighbors to help you get through it. But if you happen to get into a car accident, injure your back, get prescribed painkillers, become addicted, and then die, you suddenly become the problem. You are Christopher Doe, and you deserve the outcome your addiction has brought to you.